Knock, knock, knock.
Hi.
My name's Haley. I'm going to be your nurse today. I'm going to go ahead and wash my hands before we begin. Alright, and I'll provide you for some privacy. Can you go ahead and tell me your name and date of birth?
Sure, I'm Sam J. I was born 8/7 of 1960.
Okay, Sam. Can you tell me why you're here today? What's your chief complaint?
Sure, I have ear pain and a low-grade fever.
Okay. Can you describe that pain a little bit better for me? How does it feel to you?
Sure, it feels like my ears are throbbing and they're aching and they actually feel like they're full.
Okay. Are you taking any medications right now to help with these symptoms or any prescribed medications?
No.
Okay. Are there any other symptoms associated with it, such as hearing loss?
No, none.
Okay. And do you have any significant past medical histories, such as hypertension, diabetes, anything like that?
No.
Okay. Any recent surgeries?
No.
All right. What about your past family history? Is there any history of things such as hearing loss, Meniere's disease?
No.
All right. Have you been exposed to any environmental hazards, maybe such as loud noises?
No.
Okay. And have you been swimming recently?
Yes, I went to the beach 2 days ago and I was swimming.
Okay. And what about drinking or smoking? Do you do any of that?
No.
Okay. All right, well, I'm going to go ahead and start with your exam. I'm going to look at your eyes first.
Okay.
Take a look. And I'm going to have you read this for me. You close one eye. And if you could read this fourth line right here for me.
PECFD.
And now do the same thing with the other eye.
PECFD.
Okay, very good. And now I'm going to do the confrontation test and test your peripheral vision. If you could stand up for a moment. And I'm just going to close one eye. You close the opposite. Yes, that one. And then you just tell me when you can see my hand in your field of view.
Okay. Okay, I can see it. Okay.
And now do the same thing.
Okay. Okay.
All right, you can go ahead and sit back down. I'm going to check your pupils. I'm going to dim the light. Okay, and I'm going to turn the light back on. Look at your pupils again. All right, and then I'm just going to check for accommodation. So if you could look at an object behind me, a faraway object. Okay. And then now look at the pen light. Okay, good. And I'm also going to check for your optic nerve health, so check for Merkus scun pupils. So I'm going to rapidly shine the light in both of your eyes. All right, very good on all of those. I'm going to also check your fields of gaze. If you could stand up for me for a moment. Okay, so I'm going to hold your chin and you just follow my arm with your eyes, okay? And do the other side. All right, very good. You can go ahead and sit down. And your corneal light reflex, I want you to look at a nearby object, but not my pen light, okay?
Okay.
And the light was symmetrical in both eyes. I'm also going to use my ophthalmoscope to look at your eyes. So I'll stay about 6 inches away, and I'm just going to take a look in your eyes with this, okay? Just move a little bit closer. And I'll look at this eye. Alright, and I'm also going to check for your retinal red reflex. And so I'm going to dim the lights again. And if you could look at something behind me. Okay. And stand up for the way. Alright, that looks good too. And I'm going to move on to your ears. I know you said that was your chief complaint. So I'll take a look at those first. Okay. And just look at each portion of your ear. At the top here is your helix, and then your triangular fossa, your antihelix, the concha right there, antitragus, tragus, your lobeal, and then your external auditory meatus. And I'm going to ask you if you're having any pain, any tenderness.
Just a little bit.
Okay. And it does look a little bit red out here, and you said that you're having some pain. inflammation and I see some discharge. We'll move on to this ear. Okay. And I see some inflammation and discharge in that ear too. And this ear, does that one hurt too?
Yes, a little bit. Mm-hmm.
Okay. Alright, well I'm going to go ahead and do the whisper test. If you could close one ear up and repeat these for me. 3MP.
3MP.
Okay, and we'll do your other ear. And repeat these again for me. 2SN.
2SN.
Okay, very good. And I'm going to go ahead and do the Weber test.
Okay.
And I want you to close one ear and you tell me which one you hear at best then, okay? I'll hear noise.
The one that's plugged.
Okay. And we're going to go ahead and do your other ear. If you could plug that one up.
The one that's plugged again.
Okay. And now we're just leave your ears regular and tell me which one you hear best in.
Both about the same.
Okay. Alright, so that's good. You were supposed to hear it both equally. And next I'm going to do the Rhine test. And so you tell me when you stop hearing the noise.
Okay. Now.
Okay.
Now.
Okay. And I'll do your other ear. Again, so when you stop hearing the noise.
Now. Now.
Okay. So that was just hearing, seeing if you hear better by bone conduction or ear conduction. And so when I held it by your ear, it's supposed to be about 2 times longer, and it was. So that's good. So I'm going to go ahead and move on to your nose and mouth. So just take a peek at your nose, and if you can open up your mouth for me. All right, all that looks good. Your smile, no clenching. So that's good. I'm going to go ahead and move on to your lymph nodes. Just take a feel at those. So I'm going to feel your occipital, your post-auricle, and your pre-auricle, your submandibular, which is a little bit swollen, and your submental, your anterior cervical, posterior cervical, and supraclavicular. Most of it's felt good, but it was a little swollen by your submandibular. Was that tender when I touched right there?
Yes. Uh-huh.
Okay. All right, well, I'm going to go ahead and look at your thyroid, too. If you could tilt your head back and kind of make a swallowing gesture. Okay. I'm going to go ahead and feel it, too, and you let me know if there's any tenderness. Okay. All right, that's good. It was about 4 centimeters, smooth, firm. And the larger lobe was the right one, so that's good. So findings were, I know you said that you had the ear pain. You also had a little bit of drainage, and there was some inflammation, some redness. Your glands were a little bit swollen, your lymph nodes. So I think what happened is you probably got some water in your ears from swimming and ended up with an ear infection. So I'm going to start you on some oral antibiotics, some ear drops that have antibiotics in them, and then also start you on some pain medication.
Okay. All right. Thank you.
All right.